Hello, I'm Kara Young-Ponder, Director of Community Engagement and Racial Justice at BHHI. BHHI is a research and policy center based at UCSF, devoted to generating evidence-based solutions to prevent and end homelessness. You can learn more about us on our website. We released a report about the intersection of intimate partner violence and homelessness from the California Statewide Study of People Experiencing Homelessness, or the CASPEH. Today's webinar will discuss our findings, highlight key policy recommendations, and answer audience questions. Before beginning, we want to let you know that this presentation contains discussions of physical, sexual, financial, and emotional violence, abusive relationships, homelessness caused by intimate partner violence, and intimate partner violence experienced during homelessness. Please put your self-care first as we move through the webinar today. Today, we'll be using the term intimate partner violence, which encompasses violence, abuse, or aggression committed by a former or current intimate partner, such as a spouse or a dating partner. We have several amazing panelists today. They are Debbie Chang, who is the president and CEO of Blue Shield of California Foundation, leading its work to make California the healthiest state and end domestic violence. Upon joining the foundation, she led the organization towards increasing impact by zeroing in on preventing and addressing the root causes of domestic violence and health equity, including economic security and housing. She has focused primarily on policy opportunities to influence Medicare and Medicaid to engage in domestic violence prevention. Anita Hargrave is a faculty member at BHHI and lead author of the CASPEH report on IPV. She is also a dual assistant professor of medicine at the University of California, San Francisco and San Francisco VA Medical Center. She is a clinician researcher who is committed to patient-oriented research aimed at improving health outcomes and health equity for people who have experienced trauma and violence. Jesica Giannola currently works as a housing case manager with survivors of recent wildfires, where she networks with service providers to reduce barriers to get people rehoused. She is a fellow with the Op-Ed Project, where she uses her voice and lived experience of being unhoused to help shift the national narrative on homelessness. Jesica grew up in unstable housing and is committed to advocating for affordable and sustainable housing and services for the increasing numbers of unhoused people across the country. She was also a member of the BHHI CASPEH Lived Expertise Advisory Board. Des Martinez, also a member of the CASPEH Lived Expertise Advisory Board, is the executive director of We Are Not Invisible, a nonprofit organization that advocates for and assists individuals and families experiencing homelessness. Des became homeless for the first time at age 43 after fleeing domestic violence. Through We Are Not Invisible, Des helps those living unhoused by doing advocacy work across the country, helping people get rehoused, teaching people their rights, and making sure they have the resources and skills they need in order to thrive once rehoused. And finally, Tiana Moore is BHHI's policy director and co-lead author of the main CASPEH report. She co-led the Policy and Practice Community Advisory Board for CASPEH and leads BHHI's efforts to translate our findings into policy. Today, we will start with opening remarks and framing, an overview of CASPEH, research findings, offer policy recommendations, and conclude with a Q&A at the end. We'll now have Debbie Chang begin with some opening remarks.
Good afternoon, everyone. Thank you for having me here today. Our foundation's mission, which has been said, is to build lasting and equitable solutions to end domestic violence and make California the healthiest state. The people we serve are those most affected by domestic violence and health inequity, people of color with low incomes. We know we can't achieve our mission unless we address the root causes of these problems, which are racism, gender inequity, and economic inequity. To those of you working on homelessness, these root causes probably sound familiar. We have a lot in common. And that's why Blue Shield of California Foundation joined in the funding of the UCSF groundbreaking study. We think it's critical to have high quality research and data to inform funding decisions, to inform improvements in systems of care, and to inform policymakers in California. Today, just by being here, you're taking an important step to learn more about the interrelationship between domestic violence and homelessness. Clearly, you're interested, but you might be wondering how domestic violence relates to your work. I'll try to answer that. I have 3 things for us to think about today. First, domestic violence is everywhere. Second, homelessness is recognized as a crisis in our state, but it's rarely linked to domestic violence. And in fact, domestic violence is a significant driver of homelessness. And third, survivors are experts. They know best how systems work or fall short and how to improve them. What I hope is that as you listen today to the research, to the lived experience, and to the policy recommendations, that you'll think about what you can do to prevent both domestic violence and homelessness. We can't solve one without addressing the other. So first, what do we mean when we say domestic violence is everywhere? In California alone, 58% of adults are affected by domestic violence, either directly or through a close friend or relative. That's more than half of us on this call today. Survivors are parents, children, students, employees. They're immigrants, they're in the military, and disproportionately, they are women and people of color with low incomes. Like all of us, survivors use multiple systems throughout their lives: housing, healthcare, banking, the courts, employment, social services. Many of you work with survivors and their families in these sectors, or your work includes survivors, whether or not you realize it. So domestic violence is everywhere, but it's also healable and preventable, and we all have a role to play in ending it. On to the second point. Domestic violence and homelessness are intertwined. As we're learning from this research, among those who experienced intimate partner violence in the last 6 months before their homelessness, 40% said violence was the reason they left their last housing, and 20% said it was the main reason. Stories of survivors being forced to choose between their safety and their home are all too common, and you'll hear those stories today. Third, survivors are experts. This study is better because of the lived experience of the people on the advisory board. I want to close with an example of survivors taking action. Over the last several years, the foundation has invested in a coalition of leaders in the domestic violence field and in homelessness services in LA. That coalition is now 150 organizations strong. With survivors leading the way, this coalition has been advancing policy solutions to improve lives. For example, survivors tell us it's way too hard to use the homelessness system. An intake worker might say to someone running for their life, "You can't stay here. You're supposed to go to the domestic violence shelter," or the shelter might not allow children or enough privacy for someone who fears their abuser might find them. So you can see how shutting down a person at this critical point is a lost opportunity to keep someone safe and housed. So the coalition partnered with others to advocate for a new state law that requires the local agencies working on homelessness in California to include in their planning for the first time the unique needs of domestic violence survivors. The hope is the next time a survivor shows up, they'll not only get a room, but supportive services such as food and transportation, legal help, and housing access. All of it in a way that protects their identity and recognizes the trauma they're going through. Thanks to this new law, we have a chance to prevent both domestic violence and homelessness. So you see, when we bring in survivor expertise, we find better solutions. When we invest in research, we uncover more of the evidence policymakers need to make a large-scale impact. And the fact that domestic violence is more pervasive than many people realize means that we, all of us here today, have more opportunity for impact as well. We need a comprehensive statewide strategy to address the relationship between domestic violence and homelessness. To take on these interwoven issues, we need to support survivors' economic needs by offering flexible financial assistance and permanent affordable housing. So the question I would ask you to think about throughout this webinar is this: how does my work already address the intersection of domestic violence and homelessness? And what more can I or my organization do? Thank you again for the opportunity to speak here today. I want to now turn it over to Dr. Anita Hargrave for an overview of this incredibly important research. Thank you again.
Thank you, Debbie, for those truly inspiring and thoughtful remarks. And I want to thank you all for being here with us today. I'm Anita Hargrave, and I'm going to start off by telling you a little bit about the origins of CASPEH. CASPEH is the largest representative study of homelessness since the 1990s. Dr. Margot Kuchel is the principal investigator of CASPEH. It was conducted at the request of the California Health and Human Services Agency to answer critical questions about homelessness facing California policymakers. And it was funded by the UCSF Benioff Homelessness and Housing Initiative, the Blue Shield of California Foundation, and the California Healthcare Foundation. Within CASPEH, the work that we're going to talk about today focuses on this intersection of violence and homelessness, and it uses qualitative and quantitative methods to do that. CASPEH was conducted in 8 counties representing 8 regions. It included adults over the age of 18 experiencing homelessness, and it resulted in 3,200 questionnaires paired with 365 in-depth interviews. 50 of those interviews focused specifically on intimate partner violence. However, in our qualitative analysis, we included all interviews in which participants talked about experiencing intimate partner violence. And ultimately, this led to the inclusion of 104 interviews. Importantly, this work involves community engaged practices, including 3 community advisory boards. Intimate partner violence can precipitate homelessness. In this section, I'll present our findings on experiences of IPV leading up to homelessness. 8% of CASPEH participants experienced IPV in the 6 months prior to homelessness. 3% of cisgender men reported IPV leading up to homelessness, compared to 17% of cisgender women. Our limited data on transgender, gender nonconforming, and non-binary people indicated that they may experience IPV prior to homelessness even more frequently than cisgender peers. However, fully describing the experiences of these distinct groups would require a more specific research design. CASPEH was designed to be a general population study across multiple subject areas, and as a result, it's limited in its ability to make claims about smaller groups on specific topics. Participants experienced multiple forms of violence prior to homelessness. 94% reported experiencing physical violence, 26% experienced sexual violence, and 46% reported financial abuse. 40% of CASPEH participants who reported IPV in the 6 months prior to homelessness indicated that violence was a reason for leaving their last housing. When we asked survivors about the last place that they lived prior to homelessness, 50% entered homelessness from a non-leaseholding arrangement, 38% from a leaseholding situation, and 13% entered from an institutional setting, like a medical facility, group home, jail, or prison. The median monthly income for survivors who experienced IPV prior to homelessness was $1,000. $1,000, which highlights the economic precarity of people who enter homelessness following intimate partner violence. 1 in 5 survivors who experienced IPV prior to homelessness and reported leaving a household where they were a leaseholder had a rental subsidy. This indicates that the need to flee violence overtook our usual protections against homelessness. We want to pause before sharing a participant quote. We invite you all to take a moment for yourself, drink water or take a deep breath. Before we move on to this next section, please put your self-care first and feel free to engage in this material on your own terms. In our next slide, we're going to share a quote from one of our participants, which Jessica will read. And it shows how many survivors reported being forced to leave their homes as a strategy to survive violence and escalating abuse. The survivor explained to us,
I'm here now, homeless, because I left the house. I just needed to leave because it was more physical and more violent.
Thank you, Jessica. I'll now pass the presentation to my colleague, Des Martinez, who's going to talk about the barriers to seeking safety and support.
Thank you, Anita. Survivors use many different strategies to try to maintain personal safety and seek support. Among participants who experienced IPV prior to homelessness, 52% sought help from any source to prevent homelessness. 12% of participants sought help, and 10% received help from a DV organization. Participants reported not knowing where or how to access these organizations. Some reported not having access to phones or did not live close to a DV organization. Others reported that when they called DV shelters, they didn't have the capacity to help them. A survivor explained,
I called the DV shelter. They said that they didn't have any room available.
this forced participants to go back to their partners, to enter regular shelters, or to go to the street. Participants were optimistic that relatively small amounts of financial support could have helped them avoid homelessness. Among survivors who reported IPV prior to homelessness, 73% believed that a shallow monthly subsidy would have helped them avoid homelessness for at least 2 years. 83% believed a lump sum payment would have done so, and 92% believed a housing voucher that limited their rental contribution would have kept them housed for at least another 2 years. Survivors noted that a flexible funding strategies for food, rent, cell phone service, transportation, childcare would also help prevent homelessness. Some participants discussed staying in abusive situations to maintain housing stability for themselves and their children. A survivor shared with us,
In my opinion, probably 90% of the people that are in abusive relationships would get out if they had an out to go to. If they weren't going to lose their kids, their home, their financial ability to function day to day, then it would be a whole lot easier to leave.
survivors were concerned that discriminatory practices based on their race, ethnic background, gender, and sexual orientation limited their ability to seek safety. Several participants of color reported lack of access to needed shelters and services due to their race or ethnic background. Male and LGBTQI+ survivors told us that they experienced social stigma against reporting violence from an intimate partner. Black survivors also expressed hesitancy to involve law enforcement. One survivor explained that because she was a Black woman, she would think twice before calling the police about IPV, out of worry that they would hurt her or someone in her community.
I think twice before calling the police. You want to call, but you don't want to end up dead. It's sad to say, but it's true.
We found that 87% of people who survived IPV prior to homelessness had health insurance. However, participants discussed that the healthcare system did not have resources to meet their needs. Survivors also worried about healthcare clinicians reporting IPV to law enforcement without their consent or knowledge. A survivor explained to us,
There wasn't really any assistance at the time that I went to the doctor, and I told them about what was going on. If there was more proactive assistance when you're facing domestic violence, things have a better outcome.
Participants did not trust enforcement agencies like police or child protective services with their safety. Survivors delayed seeking help and leaving abusive relationships due to fear of being reported to child protective services or CPS and losing custody over their children. A survivor explained to us,
I've been hearing stories about the CPS, and once they know there is domestic violence happening, they're going to take all of your kids from you. I was really scared.
finally, social connections played an important role in helping to maintain safety and a degree of stability. 41% of participants who experienced IPV prior to homelessness sought help from friends and family. However, friends and family were limited in their ability to help survivors obtain long-term housing. Participants described making their own safety kits to make sure that they could leave an abusive relationship safely. A participant asked us to share with you.
Tell people to keep safe kits because it saves your life, like money or an extra phone.
With that, I will turn this over to Jessica to tell us more about her experiences during homelessness.
Thank you, Des. Okay. 8% of all CASPEH participants experienced IPV during homelessness. 5% of cisgendered men and 15% of cisgendered women reported ongoing IPV while experiencing homelessness. Among those who reported IPV during this current episode of homelessness, 94% experienced physical violence and 27% experienced sexual violence. During in-depth interviews, participants explained that homelessness left them vulnerable to increased violence from their intimate partner. A participant told us,
I'm still worried because he threatened to burn me down, burn my tent down while I'm in it. So I don't sleep here at night. I'll go on my bike, I'll ride all night long, rather be here by myself than sleeping. Then I sleep during the day because that's safe.
of the participants who experienced IPV prior to homelessness and reported that violence was a reason for losing their housing, 43% stated that there was a time when they wanted shelter but could not access it. 60% of these participants reported spending most of their nights unsheltered. 28% reported spending most nights in a non-domestic violence shelter. And 5% reported staying most nights in a domestic violence shelter. These findings indicate that many people leaving housing due to IPV do not go to DV shelters. In fact, many experience unsheltered homelessness, and others entered mainstream homeless shelters, which may not have the privacy or resources to accommodate the needs of survivors. Of those who were able to enter DV shelters, many noted that the shelters lacked access to long-term affordable housing options due to resource limitations. Several DV organizations put time limits on DV shelter stays, and given the lack of long-term affordable housing options, these stay limits could lead to returning to homelessness and increased risk of violence from their intimate partner. A survivor who was staying in a DV shelter told us,
They make you sign something saying you're not promised housing after you leave here. We're not safe after we leave here because we're going back to the street where our abusers are at. What happens after 60 days if I don't find housing? There's no bridges here. I'm scared.
Finally, we examined barriers to housing for survivors. 95% reported that the high cost of housing was a barrier to their exiting homelessness. Other commonly mentioned barriers included being unable to live with family or friends and a lack of help from case managers or navigators. Another survivor explained to us,
There should be more things for women that are abused. Somewhere to place them and house them, somewhere to give them grants, some type of funds to help them get on their feet. I have nothing. I physically do not have any living relatives anymore. My friends and family, either in Nashville, Tennessee, or in another country, I've never met them.
And now I'll hand off the presentation to Dr. Tiana Moore to discuss our policy recommendations.
Thank you so much, Jessica. For our final section of the presentation today, we'll present policy recommendations that are based on our findings. We have 4 main categories of recommendations: increasing affordable permanent housing options for survivors, promoting violence and homelessness prevention, supporting survivors currently experiencing homelessness, and finally, centering equity in all responses. Effective solutions to addressing homelessness require investments in affordable permanent housing options. Importantly for survivors, permanent housing provides the safety and stability needed to thrive and heal after experiencing violence. There is a need to expand affordable housing for extremely low-income survivors, both to allow for swift exits from abusive situations and to prevent resultant homelessness. Increasing affordable housing would allow for shorter stays in shelters as well, which would increase capacity for this vital resource. This can be done by increasing our efforts to produce and preserve affordable housing. Expansion of rental subsidies plays a critical role in increasing housing affordability for extremely low-income individuals, including survivors of IPV. Finally, we recommend prioritizing housing-first approaches, which is an evidence-based approach to housing individuals without preconditions for survivors. This would expedite access to affordable permanent housing and minimize barriers to entry. The aims of preventing intimate partner violence and preventing homelessness are closely intertwined. Preventing homelessness among IPV survivors decreases the risk that the survivor will be located by their perpetrator, which disrupts the recurrence of violence. Likewise, violence prevention can help stabilize survivors' current housing situation and prevent homelessness. Steps toward preventing homelessness among survivors include providing flexible funding to meet survivors' needs, creating specialized coordinated entry access points for survivors at risk of homelessness, and optimizing access to supportive services to manage the legal consequences of IPV. Prioritizing violence prevention includes supporting survivor-driven safety planning, improving trauma-informed care and provision of IPV resources in healthcare settings, and finally, increasing education and awareness about IPV. It is essential that we support survivors currently experiencing homelessness. We can do this through increasing dedicated shelter options and housing options for those impacted by IPV, creating and strengthening alternative options to support the immediate needs of individuals when DV shelters reach capacity. This includes motels, hotels, drop-in centers, supporting stays with family and friends, and increasing flexible affirmative outreach strategies for survivors who are currently experiencing homelessness. Finally, we must ensure that equity undergirds all of the programmatic and policy efforts that we have to address IPV. Programs and services designed for those impacted by intimate partner violence should center gender, sexual orientation, and cultural competency. Given the disproportionate impact of IPV on communities of color and gender and sexual minority communities, programs and services should be responsive to the experiences of survivors from these communities. We can further commit to equity by building systems that increase survivor-driven safety and decrease fragmentation of families. These responses should focus on promoting healing, resilience, and well-being for survivors and their families.
Thank you so much to all of our panelists for such an informative session. I'd like to invite all of our panelists to turn their cameras back on now. We have some really fantastic questions in the Q&A. We'll answer as many of them as we can in the rest of our time together. So the first question that I'd like to pose is to Jesica and Des. Jesica and Des, what changes in policy or current practices would you want to see to help survivors avoid homelessness and or to exit homelessness? And Jesica, I'll start with you.
Thank you, Kara. I feel that policy is really where it's at. So we really need to hit hard with policy changes that remove the barriers that are preventing housing in the first place. California has recently saw the SB 267, and that's really helpful for folks who have Section 8 or a subsidy, and that will help with other ways of qualifying for housing than your credit score or reducing some application fees. But really across the board, we need to see that there is housing for all approach, and not blocking someone from housing because they have a criminal history or they can't pay these exorbitant application fees. And so just reducing those barriers overall. I think that cities can play a big part in the zoning that they have allowances for building and development, and that would increase housing supplies, and also seeing more involvement from our city. Our city leaders should show a commitment towards resolving homelessness within their community and increase those housing supplies for people who are low income and mid income, and wraparound case management. It's hands down going to be one of the most important pieces as well, is having someone knowledgeable who can handhold folks who are navigating these very complicated systems and trying to connect them to resources and reduce barriers that exist. So those are things that I'd love to see change, and that would make a huge difference in our housing. Thank you.
Thank you, Jessica. Des, same question to you.
Yes, I feel more long-term DV shelters, long-term meaning they get to stay there until they go into transitional, and stay in transitional until they have permanent housing for safety. Currently, in my county, we have only a 30, maybe a 60-day at a DV shelter. To change the definition in HUD regarding homelessness and domestic violence, HUD's definition, we just never had domestic violence involved with homelessness, and they never really put those two together. More housing available immediately for all the survivors and to get rehoused for safety and out of these shelters, because sometimes our DV shelters are overloaded, so they're forced into the low barrier shelters. And the low barrier shelters, anybody can go, even your abuser. More transparency with the shelters that are receiving funds for domestic violence. I've experienced in my county that we utilize more funds for admin and not for beds. We have more office buildings than we do beds for DV survivors here in my county. So just a lot more transparency on how the funds are spent. More safe locations for domestic violence survivors. Again, in my county, my experience is we do not have enough. We have one building and motel vouchers, and that's still not enough to protect the individuals. We have mixed gender DVs. This isn't currently working. We need to think about having different shelters for each different kind of the community. We have an LGBTQ community, and a lot of our DV shelters, some individuals in there don't agree. And I find it difficult for people experiencing domestic violence, experiencing being unhoused, and a part of the LGBTQI plus community, that some of the DV shelters are just, I don't think they fully understand or have the education to understand as if an individual running a LGBTQIA plus DV shelter understands the differences of abuse that happens out here. That's what I would like to see.
Thank you, Des. The next question is for Anita and Tiana. Could you tell us what you think are the greatest takeaways from this research? Anita, I'll start with you.
Thanks, Kara. Such an excellent question. And I think that it's always hard when we're giving you a lot of information right now. And so kind of synthesizing it down into a couple of key points that I hope everybody takes away from this conversation today is that the first, many people who are experiencing intimate partner violence, particularly survivors with limited income, are forced to make this really impossible decision between staying in their current housing and continuing to endure violence, or leaving that housing and facing the very real risk of homelessness. And I think that there is more of a a perception in the general public that these survivors will be able to obtain safety and obtain help, when the reality is that many of them will experience unsheltered homelessness. And unsheltered homelessness means, living out of a car, in a park, in an encampment, and that can expose you to not only more violence from your intimate partner, but also from violence from strangers. And people are forced into these survival actions, which are increasingly criminalized, and can lead to loss of custody of children. So they are facing just overwhelming barriers to obtaining safety. The next point that I'll make is that DV organizations are really working at capacity and aren't able to meet this need for shelter in particular. They lack the access to affordable housing options and sufficient resources to transition somebody from a moment of crisis, leaving their relationship, leaving their housing, and then bridging that to long-term safety, stability, and a long-term home. And ultimately, I think that this signals that there are major systemic failures in the way that we are supporting survivors and preventing them from falling into homelessness. And that in a large way, these failures can be corrected with sufficient funding and increased access to affordable permanent housing. The final point I'll make is more from my perspective as a clinician, as a physician, and that is that in order to work towards healing from trauma of intimate partner violence, of homelessness, we absolutely have to address housing first. Our treatments, our therapies only really work if somebody has the safety and security of a long-term home. And I'll stop there and turn it over to Tiana to hear your thoughts.
Yeah, Anita, those are all fantastic points that I think are important takeaways from this. In our report and in the webinar, we cover a lot of territory, but what I hope folks kind of walk away with is that violence and economic precarity really work in tandem to increase risk of homelessness for survivors. I think that intersection is very crucial to remember. Survivors had extremely low incomes prior to homelessness. When we asked our participants to recall that period prior to homelessness and recount what their household incomes were, on the median monthly household income was just $1,000. In a high-cost state like California, extremely low-income survivors have few resources to actually escape violence and find alternate housing. Particularly when you look across the state, the median kind of rent for a one-bedroom apartment is about $1,600. So there's a big mismatch there. Another key takeaway that I think is important to walk away from this presentation from is that relatively small or modest financial support really could have averted homelessness from the perspective of our survivors. Small interventions really make a big difference for those who are at the economic margins already. When we engaged our participants in that thought experiment that we talked about hypothetical prevention interventions, by and large, they believe that all three, which were kind of modest financial supports, would have helped stave off their homelessness for at least 2 years. I think it's important to think about financial interventions flexibly, given the needs that our survivors talked about, childcare, rent, other things that are not typically covered by funding that is kind of solely dedicated toward housing. I think it's important to consider when thinking about funding. And the final takeaway that I'll just kind of briefly mention that I think is particularly important to keep in mind is that the experience of homelessness itself is in many ways a re-traumatizing experience for survivors, leaving them subject to either continued violence from their intimate partner or from what we saw in the main CASPEH report, violence inflicted by a stranger. And so what I think it really underscores is the need to expedite these returns to housing, to promote survivor safety, to prevent further trauma, and to really find a place where survivors can stabilize and heal from the violence that they've experienced.
Thank you so much to both of you. So the next question is for Jesica. Jesica, are there areas that the research wasn't able to explore enough that you thought or would like to see more researchers explore in the future?
Thank you, Kara. I do feel from personal experience, this sort of stood out to me of noticing where people may have had trouble with knowing where resources were, like how they learned about them so that they could access them. I know personally, I wasn't aware of what resources were available in my community. I wasn't aware what they could do for me, how they could protect me, or support me. And it took many years of unfortunate experience before other services stepped in and they provided that. But had I had it ahead of time, just like many of the survivors interviewed, I feel that people would seek out help sooner. So more research based into how can we get that information to people ahead of time before they even need it. And also what families can do when they have a child that is opposite gender and over a certain age. I've worked with individuals as a housing case manager where they weren't able to utilize a domestic violence shelter because they had a child that was over the age of 12, opposite gender. And so that was very difficult. It's a difficult position to place a parent into when they have to choose between staying in a situation, living homeless, or somehow separating from their children just to receive help. So I think more research is due to how do we support families in those situations so that they stay intact, supported, and prevention. I think those are definitely things I'd love to see more information on.
Thank you. So the next question from our audience is for Anita. Are there any estimates regarding the fraction of people who experienced IPV but don't reach out for support because of concerns about child protective services taking away their kids? And if not, could you just talk to how that might have showed up in the research?
Yeah, this is such an important point. So thank you for that question. The first part of the question was asking about a specific statistic. Is that it? I want to make sure that I break that down. So the question was, if we have the numbers of the participants who reported that they either held off on reporting to or seeking help for intimate partner violence due to this concern around CPS and loss of custody of their children.
Exactly. Yeah.
That is a great question. We do not have those specific numbers. And again, I just point out that CASPEH is a study that looked at a multitude of different subjects, and intimate partner violence and domestic violence was kind of a sliver of that, a very important one, but a smaller part of a larger whole. And so we don't have those specific numbers. I do, to just to go back to the question that was just given to Jesica, that would be an important thing to look into for future research. What I will say is that from our qualitative research, it was really clear that this was a recurrent theme, that survivors stayed in abusive relationships and endured violence multiple times of types of overlapping violence, co-occurring violence, because they were concerned that they would lose connection and custody over their children. And they, really would avoid getting help from healthcare workers, also due to concerns about mandatory reporting of healthcare providers, talking in the connection between healthcare and CPS or the carceral system. So that was a major issue that participants spoke to, which is delaying looking for care from healthcare providers or from other service providers because they wanted to optimize their relationship and stay with their children. And I will say one other thing is that they also wanted their children to be safe and to not be exposed to violence. And so sitting in that really extremely difficult situation was heartbreaking to hear from our participants.
Thank you. Tiana, we have a question for you. Did you look at legal needs and medical legal partnerships which encourage medical providers to screen for IPV, social determinants of health, and issues to refer for legal services?
That's a great question, Kara. We didn't specifically look at medical legal partnerships, but through our qualitative work, what really came through from our survivors that participated was the kind of need for legal services and legal support to kind of mitigate the experience or the consequences, I should say, of IPV that might take place in the legal system. I think the medical legal partnership model is an interesting one that could be explored. But what came through from our survivors is just that need to have some kind of support. And I think, healthcare systems can do a lot, but they can't do everything. But I do think that there's some opportunity, particularly given how many folks had kind of medical coverage and access to the system theoretically based on that coverage. I think there just needs to be kind of additional systems built in order to make sure that those services are afforded to our survivors.
Thank you. Des, a question for you. Are there any trainings that you'd recommend for case managers to better serve DV clients?
Better training. Have people with lived experience on your boards. Talk to the individuals themselves. Have them be a part of the conversation. That's the only way you're going to be able to actually know what we need. Like, we have to be part of the conversation. That would be probably the best training I can think of off the top of my head right now as an individual that experienced homelessness during DV, IPV. It would have been nice to go to somebody that knew what I was going through. It would have been nice to go to organizations that knew where to direct me. It would have been nice to talk to somebody that knew how to talk to me and not at me as a case number or a subject. That's the only thing I can think of right now off the top of my head.
Thank you, Des. Jessica, what about you? Any trainings you'd recommend?
Absolutely. I think trauma-informed training is a must. All of our case management out there need to have that as a bare minimum. And I feel like there should be more training also that goes in depth with equity and any specifics with interpersonal communications, any of those courses and classes and trainings that help people be aware of someone's traumatized state, like their facial expression, their tone, their body language, being aware of what might be their triggers, and then being supportive through that time when someone becomes activated, and how do they move them through that process and give them that space and hold that awareness. And I feel that those things are a bare minimum and super helpful for someone who, especially if they're going to be in a shared shelter situation, and they might have rules and participation agreements where someone has to do something, and if they don't, they might get in trouble. So those are activating for someone. So just having that awareness with any of the case management and programs that are running. Thank you.
Thank you. Anita, another question for you. Were you able to explore how this IPV affects disabled survivors? Is there specific help seeking models we should adopt for this community?
Yeah, thank you for that question. And I think that we were able to look at specifics around what we call activities of daily living or chronic conditions. I don't have those numbers on the top of my head as they apply to people who experience intimate partner violence or during homelessness or prior to homelessness. But it's an excellent point, and I do want to look into that more. I think ableism, as we think through homelessness and how it intersects with ableism and access to services, absolutely, this is an important part of the conversation around accessing services, being able to exit homelessness, and it really gets to the point of marginalization, right? And so within this framing of understanding violence, understanding homelessness, we also are talking about marginalization of people, their access to resources, to shelter, to housing. And that also ties into discrimination and access due to disability or ability, and how we talk about ableism is an important story to tell. And I don't have those numbers. I wish I had them at the top of my head right now, but I will certainly circle back and we'll look into, understanding the exact, more exactly the answer to this question. But I can say from our qualitative data that increasing access and training and understanding cultural competency, but also competency around ableism and access to services is an important future direction to take this research as well. Sorry, I don't have the perfect answer for that, but thanks, Kara.
No problem. That was such an insightful answer. So the last question I'm going to open up to all of our panelists. We've had several of our viewers today write about the kinds of requirements that someone might need to pass before getting into a DV shelter. One guest wrote, did the study observe the barriers to access that DV shelters offer impose on individuals that they know to be experiencing homelessness? And how might those requirements or those barriers actually keep people out of the DV shelters or be a hindrance to people being sheltered? So I'll open that up to whoever wants to respond.
I don't mind starting. I know that the policy with the opposite gender children and a separation is a huge hindrance. So that has prevented people that I work with personally, that one there. And I know for myself, I felt hesitancy with the requirement of household chores. When I had a lot going on in my head, I felt that the requirement was something that it kind of slowed my progress for a bit in that recovery phase of, okay, now I'm in a safe place and I'm trying to move forward, but I don't want to get in trouble for not doing something in the shared living experience. So those things can, I think, hinder folks just from personal experience.
Jessica, thanks for getting us kicked off. I hear all of the barriers that you addressed really came through in the qualitative work that we did. But I also just want to make sure that we don't lose sight of the fact that oftentimes shelters aren't able to accept folks who are experiencing DV because of the structural constraints that they have at hand, whether it be funding limitations or otherwise. And so it's important to kind of examine at the shelter level what those barriers might be in terms of eligibility and access. But I think it also brings up a larger systemic question that we need to keep at the forefront as we have conversations about this too.
I feel that if anybody's experiencing any barriers at the DV, there shouldn't be any barriers. It should be a simple phone call to the DV shelter and let them know that you're interested in safety. And it should be, where do you want to meet? On what corner? For safety, we'll pick you up, bring you to the shelter. Then you do intake. You assess from there, but you get the individual off the street immediately is what every DV shelter should be doing. Do intake there at the facility. But I'm more concerned about the hinders that the DV shelters have because they have been left out of all the funding. We need to fight more. We need to lobby for more funding to go specifically for DV, IPV survivors. When the funding is not going towards housing or shelter, then we're always going to have a lack of shelters for the individuals. Go to your city, go to your city council, go to your board of supervisors meetings, demand that they utilize more funding for the DVs, and we shouldn't have barriers. If there's barriers, fight to have those barriers removed. I'm more into fighting for a change where the money comes in at contact HUD if they receive HUD funding, if they receive state funding. There's a lot of policies and procedures and rules that they have to follow when they apply for that funding. So read those fundings, read those applications, and make sure that you're holding them accountable to utilize the funds on what it should go to, and that should be beds and safety for the individual seeking shelter.
Thank you so much. That wraps up our program for today. I'd like to thank our panelists again and all of you for joining us.